Why is it important to study sexual function in women with lung cancer? First, because over 95% of patients with lung cancer score below the 50th percentile when it comes to sexual health. We have learned through data that sexual concerns, sexual issues for patients with lung cancer persist over time. They do not get better when the patient has completed treatment. Sexual dysfunction has been associated with high symptoms burden, with depression, and with higher need for pain medications. Sexual health and lung cancer has been understudied and underreported, and the SHAWL study goal is to improve the knowledge in sexual dysfunction in women with lung cancer. What we learned from the SHAWL study is that the needs of patients with lung cancer when it comes to sexual health is very different compared to other patients with cancer. The majority of the complaints of what was affecting this woman's sexual health included fatigue, sense of feeling unhappy, issues with their partner, and shortness of breath. Shortness of breath is a unique need for patients with lung cancer compared to other cancers. In addition, fatigue is often underreported and underestimated, and this has affected our patients. We ask patients about their sexual function before and after lung cancer diagnosis. We observe a significant change in sexual health after lung cancer diagnosis. When we talk about objective symptoms, most patients report vaginal dryness and vaginal pain and vaginal discomfort with intercourse. These are two places in which there's opportunities for intervention. So what is the goal of the study? What did we learn? Well, we learned that sexual dysfunction is prevalent and very common in patients with lung cancer. 77% of the respondents. In addition, we learned that they have symptoms unique to other cancers and that we should not extrapolate information for sexual health from other cancers to lung cancer. So what should patients know? That it is important to discuss sexual dysfunction with your oncologist. It can be discussed with any members of the team. In addition, there are several interventions and programs all across the globe that address sexual dysfunction. So you can ask, you can wonder, and you also can express any concerns about sexual health to your oncology team.